started to have my seizures when I was 22. When I'm very stressed, I can have the big ones. Most of the time, I lost my consciousness and I'm like a zombie for several minutes. I'm from Madagascar. I plan to just come here for 1 year and doing a master program, and then now I'm staying here for 5 years. I'm not able to work at night because I have to sleep around 9 or 10. I come to a neurologist here in Santa Cruz, and he recommended me to go to Stanford.
Epilepsy is an electrical storm in the brain. It uses chemical reactions to build up electrical charges that then, with billions of nerve cells, neurons, talk to each other. And it's usually kind of a low-level chatter, like, people talking to each other before a baseball game begins. Whereas a seizure is when a home run's just been hit and everybody gets up and does a roar. And a seizure does that to the brain as well. It fires a lot of brain cells at high voltage all together, and it interrupts the normal thinking and the normal traffic. And how the seizure looks depends upon where in the brain it starts.
3 million patients in the United States suffering from epilepsy. About 1 million of these patients don't respond to medications. And those are the patients that we are really good at helping.
Diagnosing epilepsy starts usually with imaging of the brain. You get a CAT scan, maybe you get an MRI. You start going down this process of figuring out if there was anything in the blood work or something that might have triggered the seizure. But sometimes nothing shows up at all. And then you go down a diagnostic workup to try and pinpoint where the epilepsy is coming from.
We have the foremost technology in the Stanford Medicine Epilepsy Monitoring Unit, where we can bring people in for video EEG simultaneous monitoring, which will record their episodes and let us do a very extensive analysis in order to determine whether they are having an electrical storm in the brain or whether they are having one of the other imitators.
Stereotactic electroencephalography, SEEG, is an approach to help us figure out where exactly in the brain their epilepsy may be coming from. For this procedure, I use a very specialized robot and send an electrode to the exact location in the brain that we want to sample from. And then we can design a treatment plan based on the information that we get. Deep brain stimulation is an extremely minimally invasive procedure where we're using electricity to disrupt abnormal communication in the brain. And so we can use deep brain stimulation and use the brain's natural language of electricity to actually disrupt those abnormal signals. We make 2 small openings in the bone, and then we send wires to a very precise location inside the brain that is meant to disrupt abnormal communication that's going on in the disease process itself. Patients can have a completely full recovery of their ability to function. One of the emerging treatments, and is becoming a mainstay, is laser interstitial thermal therapy, or LITT, or laser ablation therapy. And this is a therapy where once you can find or isolate a specific part of the brain where the epilepsy is starting, we make a very small opening in the scalp that's the size of a paper cut, and make an opening in the bone that's the size of a pencil, then send a very, very small laser fiber in a very precise way, all under MRI guidance, in real-time visualization with MRI, and send it right to the spot where the seizures are coming from. And so that part of the brain that's causing the epilepsy then goes away. Patients will stay in the hospital for 1 night, and then usually can go home the next day.
I'm feeling good now. With no seizures, it's like I'm really relieved, and I have new perspective, and I have families in Madagascar, and they don't believe that I've been in a surgery. I was feeling a bit tired the 3 days, but after that, I have 4 months without seizures. It's amazing.